I think we're live, sir.
Yes. Hello, friends. Dr. Dhawan here, your ENT faculty, and I have got the privilege to have Dr. Sandeep, very good friend, and your beloved pediatric faculty. Thank you, Dr. Sandeep, for joining at the last hour. I know you are busy on a Sunday, but today is the day when a lot of people would be actually having some question in their mind that INICT did not go as per our expectations, and now how to take the journey from here forward. So my opening comment would be that if I would have been appearing in this examination, I would have told myself that this was a rehearsal for the real exam, because INICT, whatever said and done, is important exam, very very crucial exam. A lot of seats are there in a lot of premier institutes, but at the end of the day, understand that if you are doing like a good degree of your choice from other colleges, which are wonderful medical colleges, and the gateway to that is NEET PG examination. This session is about now start having a strategy for the next 4 weeks, that how, because today is Sunday and fourth Sunday from now is our examination. Let's have a very important like very carefully crafted strategy for these 4 weeks. So Dr. Sandeep, first question, and I will keep it very short and crisp session for everyone. Your assessment of INICT versus NEET PG, how these two exams are different.
Very good afternoon, everyone. Yes, sir. Said he's hosting a session and he's asked me if I could join. So, despite me, thinking about taking a nap in the Sunday siesta, having that Sunday siesta, I thought it's important to connect with the students and convey a message. INICT is done. Many of you, most of you, will be eligible for INICT, and now you are sitting for NEET PG. INICT traditionally has been a vertically oriented exam. Vertically oriented exam means expected topics, close options, high negative marking. But if your preparation level and conceptual level is good, knowledge is good, you have a fighting chance. Yesterday's exam was no exception. Expected questions were there. I would say about 20 to 25 new questions were there. Remaining 170, 180 topics were expected. They have been
Yeah.
asked in some exam or the other. I'm not saying it was an easy paper. What I'm saying is the topics were expected. For example, there was a milestone. There is always a question on milestone. There was neonatal jaundice, always a question on neonatal jaundice. There was a question on storage disorder, lysosomal storage disorder, always there. So it was a expected pattern kind of question paper for INICT. But NEET PG exam is a different ball game. The NEET PG exam is a it is a horizontally spread exam. By
Yeah.
horizontal spread, I mean, if there are 10 questions coming from pediatrics, every system they will touch upon. Every single system they will touch upon. They will touch upon pneumonia, they will touch upon cystic fibrosis, they will touch upon general pediatrics, they will touch upon milestone plus minus, they will touch upon vaccine, and they will also touch upon areas which are not traditionally the forte of INICT. So everything has to be touched upon in NEET PG. Also, the last two NEET PGs were more clinical compared to INICT. So if my suggestion to you is take these two exams in a different way in NEET PG exam. Even if your INICT did not go well, take the learning points from that and focus on the NEET PG exam. But the preparation has to be a bit different. And this is where proper strategy, proper planning comes into play. And Rajiv sir will be elaborating how you can plan better and how DocTutorials can help you in doing the things better. Over to you.
Yeah. Thank you very much, Sandeep sir. And what I can understand from Sandeep sir is that these two are little different examination, means that our strategy has to be different for NEET PG preparation. So let us count INICT as a full dress rehearsal before the real event now. Now, between these two events, we've got 4 weeks. Now, if I would have been a student whose INICT did not go really that great, but means that I'm not getting the vibe that okay, yeah, I get a good rank, and the less number of seats, so you have to really crack a wonderful rank to get degree of your choice in the good medical college over there. So my strategy would have been, number one, I will divide these 4 week into two parts. First 3 weeks, I would have one more cycle of revision in a little aggressive way. How? What I mean by aggressive? That guys, you don't have time that you can devote one day to complete ENT. For example, you have to really now half day for ophthalmology, half day for ENT, half day for for example, you can say dermatology, half day for psychiatry, or maybe three subjects in one day with dermatology, psychiatry, anesthesia should be done in one day. One day for pediatrics, like that. we have to now design one complete schedule for first 3 weeks. And if you see these 20 days, and for example, I give medicine 2 days, surgery 2 days. Okay, I do anatomy, upper limb, lower limb, orthopedics 1 day, and I do remaining anatomy 1 day. Please make a strategy that we should be, finishing one more cycle of revision at the end of third week from now. Today is Sunday. By third Sunday from now, we should be done with one more revision. But the most important thing is do not learn new things too much now. It's a time to capitalize upon what you've learned till now, rather than wasting your energy to, now know a lot of new things. That would not be really great idea. Maybe some minimal, upgradation of knowledge is absolutely okay, because you have to revise what you upgrade also. Please understand that. If you don't revise that part, it would really not be that helpful. So you have to be just not be motivated. You should be doing a smart hard work over here. Last 1 week, I would be keeping for last look of the important point of notes. And what are the important point of my notes? I do half day ENT, for example. Half day is given for ENT in these first 3 weeks. And I would just be now marking the more important points with some specific color or something like that. And I would be picking up the star pages of the notes. For example, in ENT, I would certainly, tell you audiology has to be seen again. All audiogram to be seen one more time. I would just mark some special, maybe star over there. And in the last 1 week, I would be now revisiting those star pages and star island. Now, half a day for ENT now, but in the last 1 week, 2 hours for ENT. Guys, multiple revisions are always better than single exhaustive revision. You're revising everything, and today is 14th June, tomorrow is the examination. You never look back what you have done in the first week. That's not a good idea. Rather than that, go faster, focused, and have a scope of 2 revisions. So today I'm giving 6 hours for ENT, but in the last 1 week, I have got 2 hours for ENT. Similarly, 6 hours for ophthalmology and 2 hours for ophthalmology in the last 1 week. The most important thing is carve out a plan, but follow that plan also. Problem is we start, predicting our bad result in INICT, and that start affecting the bad outcome in the, you are actually making that thing possible, that NEET PG also not go good. Forget this exam now, focus on the NEET PG. That would be a really great idea. But one request I have to everyone is every day solve at least 100 questions. At the end of the day, this paper is objective. There's no theory writing competition over there. You have to solve the clinical scenarios of ENT, pediatrics, medicine, surgery, etc. For that, you have to really, please understand, you have to master the art of solving multiple choice questions. You have been doing it, I know, but it's not that you should be theory intense now. 60-40, we always keep telling the distribution of time is. So I just give you an example, sir, that like 52-year-old gentleman, he has got right-sided glue ear. What is the priority of management in this case? We have been discussing that. Now, if you look at glue ear and you say, oh wow, grommet insertion is required, and that is the final answer. But that's not the correct answer. 52-year-old gentleman getting unilateral glue ear is a suspicious scenario of nasopharyngeal carcinoma. In this case, answer is not grommet insertion. The answer is nasopharyngoscopy and biopsy to rule out the hidden cancer of NPC over there. This kind of trick you will only know by solving multiple choice questions. So that is the reason why I'm saying that devise your day in such a way that you keep a window for just doing 100 questions every day. And in DocTutorials, we have got wonderful Q bank which has been overseen, created, crafted by faculties, and we are available also for any subsequent query you have for that. You can utilize that. Grant test, sir, what is your take on that? A lot of people say I'm scared of grant test. Sir, if you would have been a student for NEET PG 15 June 2025, what would have been your strategy for the grant test, sir?
Sir, 4 weeks to go before the exam. Whatever my preparation status, I would give 2 grand tests in this meanwhile. The first grand test should be given about 1 week from now, and another grand test about 7 to 10 days after that. Last 10 to 12 days, try not to give a grand test, because then what will happen is, suppose it is a tougher paper and you get a bad score, then your score will start. You may get dejected. End of the day, we are all humans, right? But at the same time, not giving grand test thinking कि last महीना आ गया है, I should not give. No, you have to train your mind. When you give grand test, multiple things happen. Number one, you have to sit for 3 hours, 3.5 hours, and solve the paper. Trust me, sitting for 3.5 hours without any distraction, focusing on the screen and giving the exam is not easy. Doing 100 questions, leisurely lying down on my couch like this and solving, that's very easy for you. But sitting and focusing trains your mind. Number one. Number two, you get time management, whether you're able to finish on time or not. Number three, one question is from medicine, another from psychiatry, third is from anatomy, fourth is some syndrome you have never heard. So when you are moving from one subject to another, your mind is getting the practice of not having that lag between two subjects. That thing
Yeah.
happens when you are only solving a particular q bank. So giving grand test works on that. Lastly, after grand test is over, you see where you are standing, then analyze, listen to the explanation, or here read the explanation, and then see what are the subjects in which still 1 month before the exam your score is less than 50%. Those are your problem areas. Those subjects will need maybe 10% more time compared to the
Yeah.
subjects you that they are strong, and your score in GT is also correct. That means they are relatively better. You can, you will touch them, but not to the same extent as the other subjects. So this will be a filter, multiple things at one place. And if you get a good score, it's a confidence booster. If you get a bad score, it's an eye opener. It will give you a direction that you can take last minute things. So
Yeah.
grand test, I think two are must. One is bare minimum. Okay, if you're going without giving grand test in the next 4 weeks, you're playing with fire. Sir,
Absolutely great, sir. This is strategy session for the next 4 weeks. So let us see what we've done till now. So we are making a schedule just like you guys, appearing in examination. We also appearing in examination like that. So what Sandeep sir is saying, one grand test in the first 15 days, second grand test in the second half of 15 days. So we have two blocks now. Please split one grand test in the first one and the second grand test in the second one. I think 2 halves. It means that 1 day would be taken out of the 20 days. Actually, please understand that you have to make a very beautiful schedule. That day when you do grand test, please do not do anything else. If you do not review grand test, you are creating one more source of anxiety over there. But if you know what is the utility of grand test, I will inform you that we are conducting one all India mock test for everyone, open for everyone. We will be soon showing the slide also. But what is the utility? Now, please see, utility of these grand tests is that these mock tests is what, like for example, this mock test is from 25th May to 1st June, open for everyone. So it starts from 25th May, 10 o'clock in the morning, and you can take this exam for the next 1 week till June 1st. So you have your own liberty to plan out things. That's why we kept it absolutely open for everyone for continuous 1 week, because we do understand everybody cannot take the grand test at one time only. So that is absolutely okay. But what is the utility of grand test? Number one is training the brain. As Sandeep sir said that you do not solve the multiple choice question of 20 subjects, 19 subjects altogether, and you get really tired doing the examination. It's the practice. If you train your brain to solve 19 subject questions, that would be definitely like changing the game for you. Number two would be assessing the weaker areas and laying more importance in the revision cycle in those subjects. So that is what my take would be. And third is identify the pattern of silly mistakes also. We have got, like this time, a lot of question ICT had, all are true for this except. So this kind of, it would be really, practice with what? I missed that word, not true about, false about. So those kind of silly mistake patterns you would be really, identifying, and you would be, not doing the same mistake on the exam day. Dr. Sandeep sir, my schedule, can you take off the slide now? My schedule as of now, what you told is that, sir, my first 20 days, I'm doing first cycle of revision, and second, last week, I'm doing the rapid revision one more time. In between, I do the grand test 2 times in the first half, first 15 days, second 15 days, second. And we invite all of you to take the grand test with us also. It will be an opportunity for you to assess yourself, because we really, try to put very, selected question over there, which are matching the real exam. The feedback from the previous students have been like that. There was a very close proximity to the real exam, questions over there. So please please utilize the opportunity over there. Dr. Sandeep, I am a student and I have not done orthopedics. Orthopedics, I've not done. You can keep putting your question also, we'll answer that. I've not done orthopedics at all because I was not getting time to. So, what shall be my strategy now, sir, for orthopedics, for example?
Sir, if I have not touched any subject, leaving the subject is not a possibility. It should not be the strategy. You have to touch it. At the same time, you don't have the time to go into rapid revision. You have to time to go into the detailed videos, because if you are not able to revise it at least once, you will not be able to remember and mark the correct answer in the question. See, I have to first look at the subject. Suppose it is a subject like orthopedics. Roughly, orthopedics gives about 5 to 6 questions on an average in a NEET PG exam. For these 6 questions, my approach should be two things. Number one, all the MCQs from NEET PG 2018 to 24 and INICET 2020 to 24. I have to do from orthopedics and revise them twice with explanation. That is first thing. There will always be some subjects, some topics which are relevant, which are important in orthopedics, but they have not been asked in the immediate exam. But they are important. To cover that, you need a quick revision kind of thing. And for that, one option that you have at DocTutorials is Quick Revision Program, QRP 5.0. The entire orthopedics has been covered in 8 hours. Listen to the discussion. After 2 weeks, revise it again. PYQs 2018 to 24 NEET PG, 2020 to 24 INICT with explanation. Doable, will not take time, will not compromise on other subjects, and it will give you a very good fighting chance. If the level of preparation remains the same, out of 6 questions of ortho, you should be able to get at least 4 correct, which is an excellent score. This is a
Wow.
smart strategy. This is a doable strategy. Obviously, for a bigger subject, you need to change a bit. For a medium level subject, maybe a day extra would be needed. But I think, sir, it is a doable thing rather than leaving the subject totally. Over to you,
Wonderful.
sir.
I totally agree to that. I would say this is called smart strategy. Rather than leaving the subject altogether, why not really, be, PYQ oriented topics? We should do that. And quick revision program are designed in such a way, this is a newly recorded one, and to pick up, subject video and do that. Guys, I must inform you that we are conducting a T20 series. We have been doing a lot of programs on the YouTube, which are open for everyone. You must have heard the, RDX series. RDX series is rank deciding series for INICT. And similarly, we do the 2020 series for the NEET PG, which we did last time also. We're going to do this time also. It is starting from 22nd of May, continuously covering all subjects. What are these 20 questions? These 20 questions are chosen very carefully to target the most commonly asked clinical scenario based, applied anatomy based questions, which are likely to be asked in the upcoming NEET PG examination. So you take the test on the app or the website, and then you join the discussion with the YouTube. It's open for everyone. The idea at DocTutorials is that with such a galaxy of faculties, we want to handhold you, because we do understand that everybody cannot master 19 subjects. The certain subjects turn weaker, certain subjects you cannot revise, certain subjects you need a little bit more, priming of the information. We by conducting these series like RDX or 2020 series for NEET PG INICT, the idea is to make sure that we add a little bit more to your knowledge, make you revise the critical data points in faster way, so that your rank jumps up to much better one. And believe me, with NEET PG is very different exam from, like the theoretical paper. In theoretical paper, you have to really remember the things and then write it down. Here you have got everything on the screen, like objective papers are. If you have really, heard from faculty in the QRP video or in the NEET PG 2020 video, for example, this one, and by chance, for example, this question is a very famous question we have been discussing in every RDX series, 20 series, like thyroid surgery being done, and immediately the patient lands up in airway emergency scenario. The SpO2 getting down, the cyanosis starts over there. The anesthetic is unable to extubate the patient after thyroid carcinoma surgery. What went wrong? So it's bilateral RLN injury, actually. It's a very famous question, but if we leave a subject, we leave the opportunity of scoring this particular question also. But if you do your work in a smarter way, like Sandeep sir said, that smarter way, and with the help of the various faculties like which will be taking like session like this, you will be certainly adding a lot of things to your knowledge also. And it would be definitely okay. You cannot cover every question out of ENT because you did not do ENT properly. Uh, Maybe eight, nine question come. You say that other people scored seven maybe, but you scored five. That would be really wonderful thing. This this particular phase would be to play your game best, not the best game. Now that's the two different things. I want to play the best game out of all is something else because everyone is on a different platform right now. But you can tell to your brain that post INICT, I will be playing my game, my level best, my level, considering my deficiencies. I did not do dermatology, but I can now join Dr. Pallavi's madam, the dermatology session of 2020, or I can see the QRP video of dermatology and a quick way, 4-5 hours. I see the main point and I see the previous year question topics also. Guys, this exam is not about hard work, hard work, hard work. This exam is about smart hard work. And at Doctorals, we really want to make your study really smart. We want to make it comprehensive, concise also. That's what this whole the program is all about. The QRP program, the Q Bank, actually the main videos also are like that only. Sandeep sir, last before we finish this session, I want to say, sir, would you agree with this plan, sir? You are a student. Your INICT did not go that great, but because you don't have the clear-cut key with you, you don't know how it go. So you have now two options: either to really think about it for 2-3 more days, or you want to start it from now. Don't say I'll start from tomorrow. Start from now. And the strategy I'm just sharing is that, would you agree, sir? Last 1 week for the last look of the important points one more time, 20 days for the revision. In between, induct two GTs over there, attend the rapid revision session like T20, but at the same time do two subjects every day. Somebody asked that, one subject, two subject. Let's devise two subjects to get a flavor in the day. You get a like sense of completion also. So these are anything you want to add or you need tweak in this program, sir?
Sir, one more thing. Student has said ki, sir, when we are solving and when I'm trying to look at the short courses like QRPs, rapid revision things, I'm getting that FOMO. What to do of the FOMO? See, FOMO will always be there. I keep saying that dialogue that whatever you are reading, there will always be something which will be left out. There will always, if I give you 10 years, still there will be topics which will be left out. Whatever you are reading, keep that in mind that probably this is the topic which is going to be asked. I don't know about the other programs. At quick revision program at DocTutorials, what we have made, what I have made for pediatrics, what sir has made for ENT and for other subjects, we have limited it to 10 hours. And according to us, those 10 hours, those 10 hours content will cover 60 to 70% of the topics which are going to be asked. Some calculated risk you will take, and some of the things you need to understand. You have done MBBS, you have read those topics, you are smart people, you are always underestimating your abilities. Sit in the exam, option is there among the four option, apply the logic, rule out the option and reach the correct answer. How you reach the correct answer does not matter. You will be able to reach the correct answer. And while you are practicing the MCQs, it is very important that first it should be PYQ. If PYQ you feel that you have done twice or thrice already and your strike rate is close to 90% plus, then you should go for mixed bag. Otherwise, PYQ should take precedence over other things. And don't fall prey to FOMO, because there will everyone eventually जिसका rank 1 आने वाला है, that person is also feeling कि क्या मेरा selection होगा. You need to understand that. So trust
Wonderful.
your trust your resources and just focus on multiple revision. Last thing, sir, people have a tendency to read cover to cover. You can't read cover to cover. You have to identify the areas. I'll give you an example of my subject, pediatrics. You know that certain areas are always asked and always forgotten. Development milestone, spend full 1 hour. Then you read severe acute malnutrition, nutritional indices, spend 1 hour together on these. Then you go towards 15 minutes on diarrhea, 15 minutes of IMNCI, 15 minutes cystic fibrosis, 15-minute celiac disease. Then you talk about seizures and epilepsy, another 1 hour. You would realize 6 hours, all the core pediatric contents are done. Then you start focusing on the other contents which are sometimes asked. Neonatal resuscitation, some neonatal topics you would do. Then you would go for the overlapping topics like micronutrient deficiency. When you are using micronutrient deficiency, don't read pellagra. Why? Because pellagra, if they get asked, KSL necklace photo they will show, you know the answer already. 4 Ds of pellagra you already know. So no need to revise that. What you should be focusing on, rickets is what you should be focusing on. Because rickets, they will ask you fine details of X-linked hypophosphatemic rickets, VDDR1, VDDR2. You already know this. You just need to restrict yourself from overreading the thing. Do not read cover to cover. Do not read definition and pathophysiology. INICT asks pathophysiology. NEET PG does not ask pathophysiology. So focus on the clinical aspects. It's a more clinical paper, more images likely to be asked compared to INICT. So go through the images fast, and number of readings is more important than the quality of reading. One reading versus two quick readings, two quick reading person will always have a better score when it comes. Over to you,
I
sir.
think you summarized it, sir. Sandeep sir. Two quick readings actually. We are actually propagating this two quick readings, two grand test session like T20 in the evening and reading two subjects every day. Please take home this thing and please have a genuine, carefully calculated hope that NEET PG is a different exam. I stand a wonderful chance if I spend these 4 weeks properly. So do not worry about this thing that INSTT was little tricky. It's okay. We do understand that. Maybe we get a good rank. We don't know, but we'll not really let the momentum die over here. In fact, we'll pick up the momentum from here. We have already taken rest for one day now. Let's really start with a good plan and execute that plan. Last thing I would say over here, everyone, FOMO or subject lengths and breadths and widths and all. They are like, like I know like a lot of people have got different resources and all that, but this is a time to do a smart hard work. You should not really, like get carried away with few subjects and just revise 5, 6, 7, 8 subjects now. In fact, touch upon, gynae, surgery, medicine, PSM, pediatrics, pathology. Again, like they would be dominating the show. It is the clinical sciences dominate here. You know it in the NEET PG. And maybe you are the student who never had a good grip on the first prof, second prof subjects. So you never could really get that, like feeling that INSTT really went well. But you stand a fair chance now. So rather than just getting anxious and really demotivated, let's go ahead from it. And in all these 20 sessions also, which 2020 session also, we try to really make sure that we help you identify the mistakes actually. That what kind of mistakes to do, how to think about the applied after the questions over there. And that's what NEET PG is mostly about. So thank you, Sandeep sir. Thanks a lot for coming on Sunday afternoon to be with our friends. So the whatever questions you have, you can always scribble in the comments. We would definitely, reply to that. If you have got any specific query, you can message me or Sandeep sir on Instagram or on Telegram, wherever you are with us. We would definitely help you out over there. But last thing I would like to say, Sandeep sir, through you also, that everyone let this INSTT chapter be over. Please start the NEET PG now in a more aggressive way. That's the only thing I would like to say. And just two more revision will change the game for you. And you have the time right now. And believe me, you can really score a wonderful rank if you do not waste 2 more days. In these 2 days, you can really think about, oh, I should have studied then and that and all that. Or in these 2 days, you can revise complete obs gynae and pediatrics also. And that would definitely change the game for you in the examination. And thank you very much, Sandeep sir, once again. Thank you very much, team also. And we'll come back again with a session in between as well.
Thank you, sir. Thank you. Remember, students, you have nothing to lose. Uh, Exams will come every 6 months or 1 year, but take care of your health, take care of your mental being, and say to yourself, you've done MBBS. You are the same person who has revised entire pediatrics in one night, sat in the exam in university, and passed the exam. Now you have 4 weeks to do 19 subjects, which you have done before. So realize the potential inside you. You are not Bruce Banner, you are the Hulk. Identify, bring out that Hulk for the next 4 weeks. Nothing to lose, a rank, a seat of your choice to gain. think of it in a positive way, and we are always there to help you out. Thank you, sir. Thank you for inviting me here,
Thank you
and
very
we are
much.